This is our third meeting of the Bioethics and Law Seminar that focuses specifically on what some call responsible artificial intelligence. And the mere discussion of what that would mean is interesting. I mean, is it a responsible design and use of artificial intelligence? Are we specifically talking about the artificial intelligence as an agent that is needed to be responsible when you talk about autonomous, responsible artificial intelligence? And we're focusing on medicine, so just imagine our discussions on conversational AI. To what extent could it be responsible to what it provides us with, for instance? And so it's really my honor to have our guest today with us. We started to discuss some of the concepts. I just wanted to say that, you know, we speak about medical ethics, so we speak a lot about the 4 principles of biomedical ethics. It's a way to find something universal that everybody would agree on. And let's put autonomy for a moment on the side, because maybe some people think that it deserves different types of respect. But the others would agree, I think, about avoiding harm and doing good and justice. It's really a matter of what that means. So we remain with wonderful concepts. And as you notice, Dr. Reis, I'm saying a lot of stuff that I don't know if it's going to be easier for you to solve. I'm just saying we have dilemmas in medical ethics that are general in essence. We have concepts. The general they are, it's easier to agree on, but then they're really just concepts, and then you need to pour some meaning into them. And when you start writing down specifics, then still they remain to be translated and to be interpreted and so on. So really, it's there's several bodies were trying to write different documents, and one of them is the WHO. And while we mentioned several of the concepts like avoiding bias and privacy and so on, these are again words that I hope we can pour some meaning into. So without further ado, I would like to say thank you to Dr. Reis, whom is from the WHO, from the Chief Scientist's Office, and dealing specifically with the matter of, I think, regulation and ethics. And I'm sorry, I don't have the text in front of me as my computer is acting out. And I'd like to give you the stage to share with us specifically the text that you've already created, but also what do we do with it, and how do different stakeholders, including industry, including researchers, including governments potentially, how do they use it? How is it helpful to them? And where do we take it from here? So with this, I leave it to you, Dr. Reis, to give us some new information. Thank you so much.
Good afternoon, everyone. Thank you very much, first of all, for the kind introduction, and also for the invitation for this first collaborative event with Tel Aviv University. I'm really very pleased about this invitation and the contact that we now have. And I really look forward to our discussion. I see that there are also quite a lot of people online, so that's really great. I will be very happy to first present the WHO guidance document on ethics and governance of AI, and then come a bit, as Oren said, to the question, what have we done with that? How can countries and other stakeholders implement this kind of WHO guidance, and what is in it for the future? So with that, I will speak for probably about 35-40 minutes, and then we have hopefully about 45 minutes for discussion. Let me share my screen. Just to say again, I'm based at the World Health Organization in Geneva, and I co-lead the Health Ethics and Governance Unit, which is housed there in the Chief Scientists Division. And we just had a new Chief Scientist, Sir Jeremy Farrar, who used to head the Wellcome Trust. Some of you might know him. He was just appointed last week to head our science division at WHO. So why are we even concerned with AI in the health sector? First of all, it is a huge sector and it's growing very rapidly. So there are estimates that by 2030, AI could become a $15 trillion industry with many, many healthcare applications. And as we all know, AI has a great promise, has great potential to strengthen not only healthcare, but also research, drug development, and public health functions such as surveillance. At the same time, AI for health also comes with significant ethical issues and challenges, and it could even undermine some of the most important key human rights protections. So for us at WHO, the question is, how can we, on the one hand, support AI and the development of applications in health to achieve universal health coverage for everyone, which is one of the most important goals of WHO, while at the same time we ensure that ethics and human rights are at the center of the development and the use of AI for health. And here you see another diagram illustrating just what explosion we're actually witnessing in this field, and it's really an exponential growth. For example, in the number of studies on the PubMed website, you see it starting from 2005 to 2020, and it's just incredible. Nothing I have seen in my career in terms of growth. And we see many emerging uses. A lot of them are still sort of in the development phase, but actually there is already first applications on the ground as well. So especially in terms of radiological and pathological diagnosis, in imaging, mammography, brain imaging, etc., in sequencing for immunotherapy, in the development and in the research of medicines and vaccines, we have predictive systems aided by AI that can help identify risk of birth asphyxia, and a big area for WHO, AI-based public health surveillance during and before epidemics and pandemics. One example, just to be more concrete, is AI-based detection of melanoma. And there are already several studies that have shown that AI can actually perform as well as leading dermatologists in diagnosing malignant melanoma. And some of the studies even show that these tools can be superior to dermatologists. Another example is the prediction of protein structures, a highly complex undertaking. And almost 1.5 years ago now, there was an incredible breakthrough there with the method of AlphaFold, which really has transformed our understanding of proteins and how they fold. So lots of possible applications, some of them already being applied, but at the same time, as I was saying, lots of ethical challenges as well. So first of all, WHO is mainly working with lower and middle income countries' ministries of health. Of course, we cater to all member states, but a lot of the work is really supporting countries that are still developing, and there are lots of situations where there's not a lot of resources. So the first question always asked is, if you only have a couple dollars per year per person to spend on health, how much should we, if anything, spend on AI? Is it really cost effective? Shouldn't we rather spend it on basic vaccination and appendicitis operations or something like that, rather than for these, fancy technologies? Very, very important question. And then there's, of course, the digital divide. As we know that, in some countries we already have quite a good infrastructure for digital health, but in others, there's still, a lot of investments to be made. The collection of data and the use poses obviously a lot of difficult challenges in terms of equity, but also in terms of privacy, informed consent, just to name a few things. Accountability and responsibility for the use of AI is a huge issue. Just think about the clinical application and, who would be at fault if there's anything going wrong. Is it, the developer? Is it the hospital? Is it the physician, and so forth? So many questions there. And similarly to that, the autonomous decision making. In how far can you have machines make important decisions, or rather, doesn't have the doctor or the medical staff, shouldn't they remain sort of in charge of making the final decisions? Lots of discussions there. Bias and discrimination are very big issues, and we'll come to that in a moment. There are important risks of AI to safety and cybersecurity. We see it every day, even in today's crisis, how cybersecurity is getting a much bigger problem every day. One area which was also quite surprising to me personally, I have to say, that apparently AI and some of the big machines actually consume so much energy that there is some worry, at least, about the effect on climate change. If we're all starting to computerize everything and having these machines, then we have to also worry about our electricity consumption and ultimately about climate change. Then there are lots of concerns about what impact AI might have on labor and employment. And this is, almost everything I'm discussing here is actually bigger than the healthcare sector. We're talking about automated production. We're talking about smart cities, many things, but also in health, in clinical medicine, there are people that are worried, what will be the effects on the labor market and on the employment if you think about robots, for example, in the future, potentially replacing nursing care and so forth. And finally, this is a huge issue that we have been wrestling with, is the big tech companies, of course. They have unprecedented means and power. Just to give an example, in WHO, we're about 2,500 in Geneva, and I think Google has more than 3,000 employees in Zurich, in Switzerland as well. So, we're sort of dwarfed in a way by the, power and financial means of big tech giants. And there's certainly a big challenge to, collaborate well, because we have to do that. And at the same time, to, come up with sensible regulations in this area. So at WHO, a few years back, we realized this challenge, this sort of tension between the promise and the ethical challenges. And that's when our Director General established an international expert group on ethics and governance of AI for health. And you see the membership here. It's, as always at WHO, very diverse, both in terms of geography, but also in terms of the multidisciplinarity. So lots of ethicists, philosophers, but also legal scholars, and then NGOs and many technical experts, IT and AI experts that make up this working group, which is actually still functioning. The most important product so far of this working group is this report that you see here. It was published in June 2021 after almost 2 years of work by this expert group. And I must say it was quite challenging to get this out because, as you realize, this was the heyday of the COVID epidemic. And not only us at WHO in the ethics department, we were very busy with responding to COVID, but also many of our experts were actually either deeply involved in the digital response, proximity tracking apps and things like that, or on the ethical issues like mandatory vaccination and all these things. So it was published a bit later than originally intended, but it was launched in June 2021. It is quite a lengthy document, longer than the usual WHO documents, so it's more than 100 pages. But I highly encourage you to at least look at the executive summary, which I believe is less than 10 pages. So that's quite digestible. And I will go through some of the features in my next slides. So first of all, I think one of the key pieces of this guidance are the WHO's consensus principles on AI for health. And these are really the first internationally recognized principles on AI for health. We had commissioned a systematic review, and if I recollect correctly, it was at the time already more than 70 sets of principles, either on ethics of AI generally, or nationally on ethics of AI for health. But these were really the first ones that were sort of specifically for that purpose. And you see the 6 principles here on which the working group settled after many, many months of discussion. And in the following slides, I will go through the principles and discuss them a little bit. So the first principle that the working group, the expert group felt was really key is the autonomy and protecting autonomy. And I mentioned it before, this has a relation with accountability. So humans should always remain in control of healthcare systems and medical decisions. And as far as possible, there should be informed consent. The second principle is promoting human well-being, human safety, and the public interest. So Oren already mentioned the ethical principles. So primum non nocere, or first, do no harm, is one of the key tenets. And it is also in this area of AI a really key principle to at least not do any harm. Maybe not do much good, but at least do not do any harm. And this is why there's a need for very specific regulatory requirements for safety and quality control. In many of our member states, even the richer ones, still struggle with regulating some of the AI tools, because it requires very specific skills in terms of the regulation. And many of the member states actually don't have any specific skills in their national regulatory authorities to deal with these newly arising questions. The third principle is ensuring transparency, explainability, and intelligibility. And that's quite a tricky one. So while being intelligible or understandable for developers, that sometimes most of the time I would say still works, it is quite difficult for medical professionals often, let alone patients or regular users, to actually understand what an AI tool actually does and how it works. And so some people call this the black box phenomenon. You put something in, and then there's this miraculous algorithm that does something, and then something comes out, but can't quite explain what it was and how it came to that conclusion. So that's also a key principle. Number 4 is fostering responsibility and accountability. Some people also call this the human warranty principle. So AI should be used only under appropriate conditions and by appropriately trained people. And that also is still quite a challenge, because in many countries, even the richest ones, there are not so many people who know AI technology well enough to actually use it. And so there's a huge need for training in the next decade or so, as more and more technologies will come out. So a big challenge for health systems and the health workforce. Number 5 is inclusiveness and equity. And you know that WHO, which just celebrated 75 years of existence, has always put equity and equitable access to healthcare and to health technologies as at the core of its mission. Even in 1948, the Constitution already called for the best health of all peoples, and healthcare for all these movements in the last decades really are witness to this mission of WHO. And with digital health and AI, this is not any different. So we really want to make sure that not only the richest countries and people get access to these modern technologies, but to make it as widely available as possible. At the same time, there is a big risk for bias and for disparities. So developers have to already include provisions to minimize bias, and also to try and make these technologies applicable in different settings for different age groups, for example, or ethnicities and so forth. And what the expert group was also very strong on is the need to continuously monitor the impact on equity of these AI-based technologies. Finally, number 6 is promote AI that is responsive and sustainable. And I already talked about the potential impact on the environment, on climate change, on workplaces. So it's very important to see this development of AI technologies in the wider context, and to promote AI that is both responsive to the health needs, but also is sustainable, not only in terms of environment, but also in terms of the repairing and so forth. We often have seen through the decades rich countries donating complicated technologies to lower and middle income countries, and then if something goes wrong, if the machine doesn't work, there's nobody who can repair, who can sort of assist, and there's often big problems with the sustainability of some of these modern technologies. So these are the 6 principles. I will now come to a important section of the guidance which deals with governance. And this is a very tricky question, especially at international level. I think it's already difficult enough at national level, but to come to agreement and to sort of enforceable mechanisms at an international level is, I think, really quite challenging, not only in this area, but in many other areas, as we see for climate change or also for, I don't know, human genome editing, there is quite a challenge to reach international consensus. In any case, our document contains quite a lot of legal, regulatory, and non-legal measures for the ethical use of AI. There are some areas of governance that could help with resolving the challenges, and there's a total of 47 recommendations for different stakeholders. No worries, I will not go through 47 recommendations now, but only for you to get a flavor. So we always try to address the recommendations to very specific stakeholders. So, for example, the designers should ensure that the systems are designed to perform well-defined tasks with the accuracy and reliability that are necessary to improve the capacity of health systems and advance the patient's interests. And then governments have some obligations for laws and policies. Governments and international agencies should work with NGOs and community organizations, which is really very important from our point of view, community involvement, especially also for the responsiveness of these technologies. And then civil society also has the duty to participate in the design and use of these technologies to make them fit for purpose and also acceptable to every one of us. And finally, companies must adhere to the national and international laws and regulations on the development, commercialization, and the use of AI for health systems. And again, these are just 5-6 examples of the complete set of recommendations. Now, the expert group was also very much convinced that we shouldn't stay only at the theoretical level, but we should also make it a bit more practical. And there was a lot of discussion how far we should go there, given that the report was already over 100 pages. But there was a compromise found, and actually at the end of the document, you will find a set of checklists for specific target audiences. So one is for designers and programmers, the second one is for the ministries of health, and the third one for providers, namely hospital systems and healthcare professionals, on practical steps to assist with the implementation. And just one example in terms of your healthcare providers. So questions are, what is the impact of AI on the patient-provider relationship? And there, I want to mention also a specific project by the Council of Europe Ethics Committee. They are developing guidance specifically on this question, AI and the patient-provider or patient-doctor relationship. And I believe that Israel has observer status in this forum in Strasbourg. The second question there is in terms of the inequalities in access to high technology healthcare, and this goes both ways. So on the one hand, maybe only the most well-off patients will have access to the latest technologies and will have access to the, high precision machine. Or conversely, maybe only the richest patients have access to a real doctor. Let's say if you're depressed, and we all know that psychotherapy is in high demand, and there's a very big shortage. So in some countries, and for example, I know in India, there are some programs where you have chatbots you can speak to if you're feeling depressed. And you could imagine a situation where, if you don't have private insurance, chatbots is all you have. So you get to talk to chatbots and figure something out. Whereas if you're a private patient, you will actually get to see a psychiatrist. So in that sense, it's could go both ways in terms of the inequality of access. I already mentioned the need for transparency and explainability and the need for specific training for the health workforce. There is a big risk of de-skilling that has been articulated by some of the doctors and nurses. So, meaning, if we give more and more tasks to AI-based algorithms or tools or robots, maybe you will actually forget to do some of the tasks yourself. That's called de-skilling. And then I already mentioned the potential liability issues. What if something goes wrong? Who's at fault? Could you be held liable as a medical doctor? Or what is the situation? That gets very much also into the legal questions here. Okay, so this is really the part about the WHO guidance document. So this is almost 2 years now. I can't believe how time is flying. So what have we done with that since then? So in terms of the implementation, we have done quite a lot of workshops, and I'll get to that. We have developed an online training course, which I can highly recommend. We have a lot of additional guidance and tools in specific areas. So the demand, I can tell you, has been incredible. So we've worked on many different issues, including COVID or Ebola, HIV, cancer screening. But the demand internally from WHO departments and externally has been really enormous for this area. So here are just a few examples for requests for additional tools by WHO colleagues or outside. So drug research and development, TB, tuberculosis, health financing and health insurance, ethics of using AI for that, food safety, and then sexual and reproductive health, namely cancer screening. And one example you see here, this has been a collaboration with the Healthy Aging Unit at WHO. And they were worried about the conditions in which AI could exacerbate or introduce new forms of ageism. And this has, for example, come up in the area of triage in intensive care units, where, if you don't feed the right data, the algorithm will always calculate that, there's actually less quality adjusted life years to be gained with an older patient and so forth. So a very nice collaboration, and this is the, I think, pretty fancy cover for the Healthy Aging Unit, which designed this document for us, and a good example of our collaboration. I mentioned we have developed an introductory course on ethics and governance of AI. You see here the link, and you don't have to note it down, by the way. I will share the complete presentation with Oren, who can then distribute everything. Sorry, I should have said that earlier, now that you have taken 10 pages of notes or something. But anyway, and I highly encourage you to go through this course. It's been very well received. More than 12,000 learners. But now you get a certificate in the end from over 130 countries. And here, just quickly, it's a 3.5-hour course. Of course, I always try to click through quickly these courses, so maybe you can do it in an hour or so. No, just kidding. There's some videos, so if you want to watch all of them, it does take at least 2 hours, I would say. But it gives you quite a good feel, and maybe it's more fun than to read through the whole report to do it with this course. Again, you can get a certificate at the end. And then we've actually started now developing a second course, which is an online curriculum for programmers. So there is a WHO expert group together with the International Telecommunications Union, ITU. This is a big collaboration. And we hold regular meetings. In the one in Berlin almost a year ago, the designers and programmers, they said, we like your document and we like your general course, but actually we still don't know how to include ethics in our programming. So, if we want to take ethics by design, as they say, serious, please develop a course specifically for us, following the programming process, and tell us how to include ethics. So that's what we have been doing I think we started in November, to be honest. And we now have a pretty good concept. We have some case studies, we have an outline, and it's sort of being developed. I hope that by the end of this year, we will have that second, more specific course. And actually, we're also thinking about a specific course for research ethics committees, because that has also come up. More and more research is AI-based or is on social media. So it could be a course on digital health and digital research, basically, that we're at the moment thinking about. So WHO, on one level, produces a lot of guidelines and norms, but then we try to really disseminate through regional workshops as well. So we have had a couple in the last few months. One was for the Americas. So in Panama in November, more than 70 countries, participants from most American countries participated. A second one was in the European region, mostly for the Western Balkan countries, that took place in Copenhagen in December. And then in end of December, we were in Cairo. I was there as well. That is our regional office for the Arab countries, with participants again from most of the countries. And what was really amazing to me there is that in countries like Egypt, there are lots of developments also on AI, even virtual hospitals. Saudi Arabia also, virtual hospitals. It's really rapidly developing virtual scribes. It's quite interesting that even in some countries that are maybe not so advanced, there's lots of interest and lots of investment already in this area. So some additional things or projects we're at the moment engaged in and that we're planning. So we want to do regional workshops for other WHO regions in Africa, in Asia, so Southeast Asia and the Western Pacific. But we are also open for requests from countries to do joint workshops. So there are a few countries who are specifically requesting, especially in terms of the regulation and health legislation as well. So that's, we're open for requests from our member states always. In terms of more guidance, we're at the moment producing a policy brief and a checklist on health legislation, because that is a big demand, the ethical principle. How do you actually then bring them into law and regulation? I already mentioned that we are working on health financing, but also on the area of evidence-informed policy development. So, for WHO guidance, usually there has to be a synthesis, a sort of meta-analysis of the data. And if you look at, generative AI like ChatGPT, you can easily ask these kind of questions. What's the evidence on, or what are the studies? And they're starting to have sort of first tools. And the question is, how will this change actually the synthesis of evidence, and how this will potentially change the way WHO will develop guidelines in the future? On the area of epidemic surveillance, WHO just 1.5 years ago established a new center in Berlin together with the German government it's called the Berlin Hub on Epidemic Intelligence. And they are using a lot of AI-based tools as well, with, of course, some ethical issues attached. So we have been working with a few experts to look at that and are also developing a policy brief in this area. And then maybe a month ago, we established a new working group on the ethics of generative AI in science, healthcare, and medicine. Just had, I think, second expert group meeting on this yesterday. And today, 1.5 hours ago, our expert group on infodemic management and social listening just concluded. So that was my last meeting before this presentation. Very important areas that have come up as very challenging topics to the WHO, but also to World Health more general. I think for the infodemics we have seen in COVID-19, there have been lots of challenges. Trust in science has really seriously been eroded. And the question is really how you can manage in this area, respecting ethical principles. So where are we going with this? Just a few last thoughts before I conclude my talk. I think it's fair to say that there are enormous possibilities of new technologies, not only in AI, but also genome editing, for example, or neural technologies. There is really a revolution ongoing. There's an enormous potential for clinical care, but also for public health, and for some countries for leapfrogging, that countries that aren't so far advanced, that could actually jump and use maybe with telemedicine, for example, some of the AI-based tools. And this could really, in the midterm, help greatly to advance universal health coverage. At the same time, I hope I have shown, and I think you're all aware, there are serious ethical challenges and risks if we are not careful and are rolling out these technologies without, proper guardrails. And this is why we definitely need national and international standards and regulations, and have to be very careful to already think in advance. Ethics always comes, or not always, I shouldn't say that, but very often comes as an afterthought after we already have a technology. And I think in this area, it's particularly challenging for a field of ethics and law to, keep pace with the rapidly developing fields. And I will end with this quote by the famous physicist Stephen Hawking, who unfortunately passed away a few years ago. He says, "Our future is a race between the growing power of technology and the wisdom with which we use it." And I want to thank my colleagues at WHO in the Department of Digital Health and Innovation, with which we have closely collaborated, Samir, Shada, and you, and also Rohit Malpani, our consultant. And finally, all of our experts in the WHO group on ethics and governance of AI for health. And thank you for your attention, and again for the kind invitation. Looking forward to the discussion.
Thank you so much, Dr. Reis. You can now stop the share. And we invite you all to open your cameras, if that is possible, so that we see the people when we talk. Before we open up the discussion, I just want to kind of comment on what you just said. So I don't know, we can look at Asimov's rules on robotics from 80 years ago as the beginning of the discussion on ethics in this regard, maybe not as developed. And I would say that while you were talking, seeing all the activities that you're doing in the WHO, I was wondering whether or not it is you or an avatar that is talking to us, or at some point in the future that might be a possibility. And then if something that is said might not be perfectly aligned with what the real speaker intends to say, you can always allude it to AI-related hallucinations. But that's just besides the point. So let us open up the discussion. You may raise your hands if you want to say something. Dr. Saban wrote to me already, so I'll just let you skip the raise hand part and just unmute, and you can say what you wanted to say. Just sorry, I unmuted you while you were unmuting yourself, and the earth collapsed.
What about now?
Yeah.
Great. So thanks for a great lecture. You sit now in Switzerland. Some of us sit now in Israel. And there are several platforms nowadays that allow one to collect data from international subjects, international individuals. Like I can sit in the US, collect data from participants in Switzerland, and like Prolific, mTorque, if you know these platforms. And I wonder, what do you think are the criteria for this kind of research, or this kind of basically collecting data from individuals residing overseas?
Should I answer one by one, or
you could do that? Yeah.
Yeah. Okay. Yeah. Thank you for that question. That is actually really a very tough one, because this is where different regulations meet, but also ethical principles, of course, come in. So you know that we have varying standards, legal standards in different countries. So Europe has quite strict ones, and many other countries as well. But at the same time, we have some countries where they are next to no rules, or not very specific regulations or laws on that. And this is, I think, very, very tricky to then come to an agreement on what the standards actually are. So I think this is really where ethics can at least support. Well, some of the countries are getting their laws and regulations up to speed. And I think it's very important, as we said in the WHO document, to obtain informed consent as much as possible. Sometimes it's not possible, but in areas where it is possible, especially when there is sensitive data collected. In health, we're sort of by definition often talking about sensitive data. Then we should really try as much as possible to have informed consent, and also do the data collection on a needs to know basis, and sort of collect only the minimum data and share the minimum data set that really needs to be shared for the project. And I should probably stop here to see how many more questions there are.
Yeah, so thank you. And may I just add that this is an issue that is not specifically only relevant to AI-related matters, but it's generally an issue we're dealing with when it goes to anything that is collecting data with the technologies that we have in our hands. And I think a lot of people focus on data security and cybersecurity and privacy issues that are not necessarily unique to AI, because they're still bothering us very much, which is okay. It's a part of the AI-related issues, but I think there are some issues that may be even specifically unique and challenging that AI presents us with, that makes sense for us, I think, to even delve deeper into when we have this discussion. So thank you. Dr. Ben-Simon from Canada. Cecile, you are unmuted already, so.
Thank you. Excuse me. Good morning from Canada. Very nice to see you, Dr. Reis. Thank you very much for this excellent presentation, excellent body of work. Really appreciated seeing how well it's conceptualized. I want to probe a little more about one of the key ethical issues that you identified as the challenges in the commercialization of AI. As we know, most of AI is coming from the private sector. And so how do we reconcile the view that it presents challenges while at the same time we know that it offers opportunities? And as you said in your conclusion, there's enormous potential. So I wonder if you can elaborate more on why it was framed as challenges in commercialization rather than looking at both challenges and opportunities. Thanks.
Yeah, thank you very much for this great question, Cecile. Nice to at least meet you. I'm guessing you're still based in Toronto, in Canada. But anyway, that's beside the point. Anyway, I really thank you for your question, because it is one of the really difficult issues to deal with. And this is true both for WHO, but also more generally. So, you know, WHO has very strict policies in how to interact with industry, notably with the tobacco industry. You know, there's basically a complete ban on collaboration. But then there are other actors like the pharmaceutical industry where collaboration is very much necessary and is very beneficial. And I think it is very similar with big technology companies. You know, they are the drivers of innovation. They're really needed with all the investments, the entrepreneurship. So absolutely a key partner. At the same time, we have to realize that, you know, these are basically profit-driven industries. So they, in the end of the day, they're not there to, you know, they don't have as a first aim to improve public health. So it's very important to have, you know, collaboration, but with certain, you know, guardrails and rules, and we have to be quite, you know, mindful of the different roles that each of the partners has. And I think so it's in this spirit that we are really, you know, seeing this collaboration. And I think it would be very similar for national actors like governments or ministries of health. So, you know, a lot of fruitful collaboration is needed to reap the benefits of this great new technologies. At the same time, we have to be really careful to, you know, to make sure that the regulations keep pace with these incredibly rapidly developing technologies.
Haifa University.
Thank you. Do you hear me?
Yes.
So my question is this. You mentioned ChatGPT as an example for when using meta-analysis and stuff like that, right?
Yeah.
And one of the things that concern me with using ChatGPT is that often it makes up a lot of things. Often it says stuff that is simply not true. And the only way I have to make sure if what it says is true or not true is to go back to the actual research and look it up myself. So I guess I'm worried that relying on this technology too much is sort of might be risky in the pure epistemic sense. And also, I mean, meta-analysis are always violated in the fact that I choose the kind of research that I include or that I exclude for various reasons. So how do we actually trust the technology to do that for us properly?
Yeah, thank you. Again, a very good question, and one that our WHO expert group is at the moment deliberating. So I think you were talking of the phenomenon of so-called hallucination, which is quite interesting. So as you said, often the results are quite good. And then all of a sudden there is an element of which seemingly has been completely made up. And this is a big challenge. Actually, the challenge at the moment is maybe not as great because many people are still a bit, trying out these new tools, generative AI, and are doubtful, are very skeptic, and let's see what they do, whatever. I think as we're getting more used to this, and maybe there are less and less of these hallucinations, and we are all sort of starting to trust these generative AI tools, then it could be really dangerous if there's one of these bugs in there. Let's say we're doing this big analysis of different, evidence, pieces of evidence on a certain drug. And that would be the basis of making recommendations for policymakers. And then there's some study that is just made up. So it is a big problem that I don't think anyone has the solution to yet. And maybe there has to be technical solutions also on this somehow to double check some of the facts. I am not a technical expert, so I can't speak to that, but I think for the moment we have every reason to be very cautious. Over.
Yes, thank you, Hadassah.
Yes, thank you very much, and thank you also for this very interesting presentation. I specifically appreciated your discussion on the different principles that are outlined in your work, specifically addressed to the receiving end, so the patient really, like autonomy, including informed consent, and also transparency, explainability. But while you were speaking, I was thinking about these concepts, and in theory, they're very good concepts, I think, very good principles to adhere to. But in practice, coming from the GDPR landscape, what you see with informed consent, for instance, in theory, it's great, but in practice, especially in scientific research in the health space, it's very difficult to really get informed consent from patients because oftentimes they really don't understand what's going on. So either you tick the box, not really knowing what's going on, or you have to figure out what's going on. That's oftentimes very hard. So I was curious, looking at this topic from the other perspective, what are your thoughts in light of digital literacy on the responsibility of the receiving end to understand how these technologies work? And I was also curious whether the WHO is actually working on guidance documents, education for the receiving end, and if so, what that looks like, or what you believe is necessary perhaps in this respect.
Yeah, thank you for that question. There is no doubt that this issue of literacy is absolutely key. And I talked about the training needs for the health workforce, but you're absolutely right. We need to engage with the patients, with the community more on, to make them understand these new technologies. And I think that also goes sort of hand in hand with combating infodemics. I think if we're all more educated and maybe then have a better judgment of what some of the information could mean that we can retrieve, then this will go a long way in terms of actually making informed decisions and providing consent on whether it's in research, whether we really want to participate in some of these, internet-based research projects, for example, or whether we agree to the use of AI-based tools for our care. So that is really very important. We haven't had any resources for the moment to engage in the development of such tools, but it's a very good suggestion that I have noted down. We have engaged, what we have done is we've had two major meetings with NGOs, with community-based organizations and for example, Transparency International, who are working also with different patient groups. But I can't agree more. There is a lot to do in this area. And we should certainly look from a WHO standpoint into producing some of the material for health literacy in digital health. So thank you for that suggestion.
Thank you. More questions, thoughts, ideas, short songs that you may have written during our conversation? So, yeah. Yeah, Mo, please.
This model are getting better more and more. So regarding the comments from Haifa University, I think that, you know, in the upcoming years, the ChatGPT will be more accurate and the reference mention will be more, we can use these tools. So
yeah, so what you're saying is that we are discussing the general concept rather than the current tools that are changing and adapting and developing and becoming better. That's a good point. So I have like a million questions, but I'll start with one, if that's okay, Dr. Reis.
Sure.
So you presented really a very large amount of work that is very impressive and I think very useful and very well organized, and it makes sense, especially to those who are already dealing in some way with this topic. My question is, within those recommendations or guidelines, is there also kind of a guidebook for the patient, for the people that we are aiming everything at? Like you have 10 guidelines for a patient, check the handwriting of the doctor, sometimes they write mistakes, whatever. We had that 20 years ago when we were telling the patients, take responsibility, protect yourself because it's only humans who are, you know, dealing with you. Maybe now it's time to consider, take responsibility because it's only machines who are treating you. So you need to, you know, in any way you have to take some, it's good to provide patients with some empowerment. And so I'm wondering whether you did it, and if you didn't, how do you like this idea?
Yeah, thank you very much, Oren. I think this goes hand in hand with what Hadassah just said. And actually, if I look at our checklists, which are for designers, ministries of health, and providers, it is true that this is somewhat a gap, you know. Whereas we had some NGOs and patient representatives in our committee, it is true that for the moment we don't have any tools in this area. There are a few, actually at the beginning of this project, in end of 2019, we had a hard time identifying specific NGOs in this area, I have to be honest. There are a lot of activists in the area of HIV, for example, or TB, for specific diseases. You know, if you have a certain disease, you have a tendency, of course, to engage in finding a cure, or, you know, but there are not so many people sort of suffering from AI-based technologies or something. So, you know, that's why, you know, transparency. I mean, there are some of these, let's say, data protection, maybe NGOs were most close to this. But it's true that in the course of the last couple of years, there have been quite some developments there. And for example, I know in the Netherlands, they have fantastic patient organizations which have produced, you know, a lot of information material. And this is definitely an area where we should do more. I really agree with you. It's true that WHO traditionally deals with ministries of health, and then even the designers and programmers are a new stakeholder group for us. And then maybe the medical doctors with the World Medical Association, for example. But the patient focus is not something that we have had so much in this area. So thank you for that suggestion. Noted.
Question that I'm thinking about, I'm grappling with, and I wonder if you have thoughts about it. So I think the concept of informed consent is a very legalistic one. It's also very limited in scope in a way. It looks at a certain point in time where I offer something, you either accept or you don't, and it's based on the necessary information. I think that the nature of being a patient and having a therapeutic relationship, includes many other moments of decision making and relate to autonomy in a wider sense. And I wonder whether the concept of informed consent is a good one, actually, when we talk about the use of AI in so many different aspects of the treatment and the care that people are already receiving today. So I need informed consent to explain exactly how the AI-led, I don't know, colonoscopy is done, or just writing it down is enough? Is it okay that the HMO just, puts big ads on the roads? We are now using AI. We are wonderful. We are magical. What kind of consent are we looking at? And should we maybe add the concept of cost benefit to it? So basically, whereas there's a potential a lot of benefit and the cost seems to be a very minimal one, maybe we should consider kind of a different type of idea, just informing rather than informed consent. Otherwise, if I want to say, look, take me out of I want to opt out. You can't opt me out sometimes because it's like, the system already built itself based on data. Maybe mine was there. Nobody knows what portion of the data that is mine influences it. Is it even like, in a way, maybe it's almost impossible. So how do you combine the will to allow it to develop and be used with the will to say, look, you got to put boundaries. Otherwise, everybody's going to do whatever they want, and it's risky.
Yeah, thank you for that question. So this has come up in a major way also in the working group of the Council of Europe that I had already mentioned on ethics and the patient-provider relationship with the use of AI. And so that is actually a very valid question. Is there an ethical obligation to always mention whether AI technology will be used in the diagnostics or in the cure? And I think most experts would agree that at least for the moment, there should be such a duty. But at least some people also think that maybe this is more of a temporary issue, such as, when we first introduced other new technologies, maybe that was sort of still mentioning some, I don't know, blood analysis machines or something, but by now, maybe we've gotten used to using huge machines also otherwise in, I don't know, in CT scans or MRIs and so forth, so that not every technical detail is neither understood by the professionals, nor can be explained in any detail to the patient. And some people wonder whether maybe with AI over the years, we will get into such a phase where basically it's sort of commonly accepted that, AI is a great tool which will assist. We can maybe mention it, but it wouldn't be, in a sense, part of the, specific consent. So, but it would be interesting to hear also from others what they think about this issue. Is there an ethical obligation to always mention if AI is being used?
I think participants, would you like to know about that every time? Is this something that you would feel necessary to know when you're a patient? What are your thoughts? I would do a survey, but I don't know how to do it. So maybe just, I don't know, just let us know, because this is a big question. I think it's relevant. There's a lot of quiet here. Any thoughts on that? So you see, there's a lot of question, right? People are afraid to give the wrong answer. I don't know if there are any wrong answers here. Amir, I feel like you have a lot of things to say. Would you like to say something?
Yeah, definitely. Both Hadassah and you already asked most of the questions that I wanted to ask, especially about consent and other aspects of including the person themselves in the process of building those responsible AI principles. And so I think that most of the things that I wanted to ask are already covered, but I wanted to say that, first of all, it was like an excellent lecture, and thank you very much, Dr. Reis, for sharing with us this information. I'm wondering, like, you know, like, in terms of bringing really practical tools for the lay persons, both professionals and patients, to what extent can we, even in terms of consent, now with all the generative AI, machine learning, deep learning, etc., when, as you mentioned, it's kind of like a black box, and most of the people don't really know what's between the input and the output. How can we somehow make it more understandable for the patients? What practical things can we provide in terms of, like, again, like to give them the ability to say if they agree or not, to agree to what, when does it end? So I think there, in that sense, there are a lot of open questions. And I personally, I'm not sure if I want to know as a patient every, you know, like maybe in terms of really critical changing of using the data, or I don't know. I think a lot of open questions, and the challenge is to somehow bring it to a more practical level, both to the professionals that, like, as you mentioned, a lot of them don't really know exactly what does it mean using AI and what are the implications, and definitely for the patient. So definitely a really interesting topic, and I hope that here in Israel, we would love to somehow use maybe you know, adapt the things that you have done in the WHO to the Israeli population. So maybe we can discuss it further. How can we do that? Those are my thoughts.
From Amos, and then you could respond to both, Dr. Reis. Amos, please, you can unmute. Wait, Amos, please unmute. We are muted.
Okay.
Yes.
Okay. Thank you very much. That's really enlightening. I want to say something about the informed consent, that the way that IRB phrases or approves the informed consent is not intended to protect the patient so much as it's intended to protect the physician, and particularly the institute. And I think that's an important thing. As regarding the AI, I think the problem is, as has been mentioned, that many of the patients, most of the patients do not understand. We don't understand it. So if I prescribe a drug to a patient, I'm supposed to tell the patient to give them the details about this drug as much as I can, and they should know enough to fulfill their interests. With AI, where we don't know how to answer this, so there is no way that we can fulfill this. So whatever we do, we are going to use AI. To some extent, we are using it all the time. We're going to use it even more. We cannot prevent the progress of science and technology. So I think we should try to find a way around this, because the patients should not expect that we can answer their questions, or their questions would be there to be answered. Thank you.
Yeah, thank you for these questions. And I note that there's also an additional one by Sheikh Farid about the adaptation and implementation in different contexts in the chat. So yeah, lots of very good questions and comments. I take it mostly as a comment from Amir. And in terms of the informed consent, yeah, I agree very much with Amos. It's going to be really challenging. I mean, if we're talking about research, I think it might, in a way, be easier, because then you will have a company behind, which normally should be able to explain what their tool and their algorithm is doing, and they have lots of resources to come up with a very smart informed consent explanation, and maybe have a specific staff for this. Where I see it more difficult is maybe in the clinical application. If you're there as a doctor, and where do you get actually all the information from for the different applications, and what risks they entail, what are the benefits, how do they actually work? This black box phenomenon that could really be quite challenging. I totally agree with you, and we're in sort of new terrain. I mean, it's a bit similar, I think, to when maybe first the MRIs came up, where people didn't understand how they worked. But that's certainly something that the field has to work on. And even on the research ethics side, I think we need possibly some new tools in this area, especially also for online and internet-based research. In terms of the implementation of WHO guidance in different countries, so first of all, our documents are, WHO has only soft power. There's no enforcement mechanism per se for WHO's guidance. We are developing mostly guidance for the member states and guidelines, but it's for them to take them up and to adapt them and implement them in their national setting. And of course, we can, advise on how to do that, but in the end, it will be up to the countries to really ensure the uptake. And there can be, of course, and there must be differences in the implementation depending on the culture. Of course, we as a UN organization, we have to insist on the importance of human rights. So there are some boundaries how you can implement the guidance in terms of discrimination, for example. But I think it's very important to adapt the WHO international guidelines to the national level, to speak to your audience, to your population, and make the guidance relevant at the national level. Over.
One last issue that I felt was very relevant. Oh, there's somebody raising hand. That's good. Adiola, you're free to share your thoughts with us. Just unmute.
Okay. Good afternoon, good day, good evening, good morning, everyone. Thank you for that great presentation and for sharing the WHO perspective on regulation of AI use in health. Currently, I stay in Nigeria. I do research in Nigeria. My team is working on governance of data science and research in Nigeria. And, in speaking with stakeholders, health researchers, data scientists, some they've highlighted what are the critical, ethical, legal, and social issues. Consent, I've seen many people spoken about consent, whether people should take broad consent, whether we should take, different type of open consent and things like that. And I don't know what's the position of WHO about this. Because sometimes when data is being collected, you don't have, you are not thinking about using it for AI. Those data they were collected in the time past, HIV data they were collected 10 years ago, some of this morbidity data were collected. You don't have AI or machine learning in mind at that time. So what do you do? How do you ensure that you are making good use of this data for prediction, which is going to benefit the health system, is going to benefit the populace, and you're also not infringing on the right of the people that are contributed this data initially, because you didn't tell them that you are going to be using AI or you are going to be using machine learning algorithm. I don't know. I mean, in low and middle income country like ours, you know, there is this challenge about consent education, because when people even come, when you are recruiting them for research, all they want to do is just to sign the paper and go and ask them a question. And but we have AI throwing up a lot of things, ethical issues, legal issues, social issues in recent time. How do we go about this? That's my first question. I know our time as well. Then the second question is on the governance, whether it should be local governance that should be relied upon in regulating participant protection, or international governance, because I'd had to talk to people, stakeholders, and they are of the opinion that I'm sorry, this might go back to WHO, that looking at the role that WHO played during the coronavirus, they don't want to trust WHO with some health information. I mean, during the coronavirus, everybody was running etasketa, and we don't even know where we are. Number of informations have been leaked out. So should we rely on local governance, or we should rely on international governance? And what are the role of funders, you know, in low and middle income country? Like, what are the role of funders in this kind of governance? I don't know if my question is clear. Sorry, I put in a lot of things into the discussion. Thank you very much.
Yeah, thank you very much for that question, or those questions. Actually, it was they were very clear. The problem is that they are very complex questions for the 3 minutes we still have. Let me put in the chat a very relevant resource on this. This is the WHO policy on sharing and reuse of health-related data for research purposes. And I think that really speaks a lot to your question. And this has, you know, come out in a major way during Ebola already, but also again during COVID, you know, under which circumstances countries should be sharing and actually have an obligation of sharing their data in terms of the, you know, even the different virus strains, you know, that there have been a lot of discussions on this. But it has major implications, of course, if this is sort of, you know, personal health data, and very complicated questions that I fear we can't really properly address now. But thank you for that contribution.
Questions were asked regarding genetic data or samples that were collected from newborn, for instance, in different countries actually, and they were not thrown away. And several years later, whether or not would it be okay to use them for a wider, you know, kind of use that might, you know, save lives. But then, do you need to go back to the millions of parents or people who own those samples? Can you find them? Should you do it? These are questions that were they reached courts in different countries, in the US and other places, and there isn't one solution to them legally in different countries. But I think it only shows that many of the questions that we've been grappling with over the past 20 or 30 years in medical law and medical ethics, they are now getting maybe a different look, and maybe it is also different in some ways, but it's similar in others. So we may start looking at some of the concepts in past documents that don't necessarily focus on AI, start there, and then look at the complications that maybe the use of AI, I think specifically generative AI, add to the equation. And I cannot thank you enough. I mean, I can, but we only have 2 minutes. I really think this was important for us to get this information as a part of our ongoing discussion. And I want to share with you that our next meeting, only a month from now, so we'll miss each other quite a lot, but it will focus on AI and digital tools used in health research, so ethical and legal implications. And we will hear Dr. Camille Nebek, the director of the University of California, I think, San Diego Research Ethics Program, focusing on that. So we'll share the information with all of you. Thank you for willing to share your presentation with the participants. So after you send it to me, I'll send it to those who participated. And I just want to say that I think with all the maybe criticism that the WHO may receive from some, I think those who act, they will also receive criticism. But I don't think there's much doubt that there's a lot of activity done in the field of ethics and regulation. And that's, I think, very important. You don't have to agree with the documents. You have to know them so that you can discuss them at least. As you said, they're not binding. Although I don't think that those 6 principles that you shared with us, there'll be much debate on. So thank you very much. We have reached our time to end this meeting. Thank you everyone for joining us, and see you on our next seminar.
No, thank you for the invitation and for the great discussion. Really fantastic questions. I hope we'll stay in touch.
Let's do that. Thank you very much. Thank you.